Nepal has serious health problems because people don't have access to clean drinking water and many households don't have toilets. This is made worse as Nepal does not have sufficient resources to provide health services for its rural communities, and a lot of country residents don't use the health services due to cultural influences. Vin has been undertaking other development programs in Jitpurphedi since 2005. The community lies 11 kilometers away from Kathmandu and it is an agricultural community with about nearly 6,000 residents. Since 2009, Vin started its health program to help people in Jitpur with all their health problems. Vin has already placed a doctor at the health post, organizes health camps and is creating a waste removal system to keep the community clean and healthy.
Basic treatment, as well as we can make community people aware of their health and hygiene issues. That's how we created this community health program. Every household should have toilets. Every community should have access to clean drinking water, and then every community member should be aware of their basic health and hygiene. That's what Vin wants to achieve in the community.
Before the start of Vin's health program, there were no health facilities in the community. Vin now provides medical supplies, medical staff and will install a basic lab for tests in the health post. The health post's facilities were upgraded and is now easily accessible for community members. Vin also provides sufficient basic medical supplies that are distributed for free. Now members of the community can visit the doctor 3 times a week. Dr. Lakshmi is the doctor in the health post and tells that being a Vin doctor is so much more than being a regular doctor.
Regular doctor obviously the curative approach. I mean, they treated the patients, but in the Vin, I have to look towards the preventive approach also. We do the awareness related program in the community regarding health and hygiene sanitation practices, because we identified that hygiene and sanitation is the most important one, and people get illness because of they are quite more aware about the hygiene and sanitation, but they are not practicing. So our main aim is to make them use these practices in their daily life. We have to change their attitude.
80% of the houses in Jitpur community do not have toilet facilities. Not having access to a toilet can cause us many health problems. Vin wants to build toilets for the 600 families without toilets. International volunteers can participate in the toilet construction program and help the families build the toilets. So far 33 toilets has been built, so there's a lot more work to do. Gloria Yang, 26 years old from Canada, was a health volunteer for 8 weeks and experienced that being a nurse in Nepal is quite different from being a nurse in Canada.
Here I work with the doctor that's employed by Vin. So we're at the health post 3 days a week. They come with a whole variety of conditions. Most of the things that we see are stomach gastrointestinal illnesses and infectious diseases, mostly caused by poor sanitation. One of the differences with being a nurse in Nepal compared to Canada is that you have to get used to not having the supplies that you normally have at home. But here you just don't have that equipment available, so you have to make use of what you have.
Every 2 weeks, Vin organizes a health camp. The doctor, a health volunteer and a nurse go to either a school, an orphanage or an early development center to check the health of the children and to provide free medical supplies as required. The health volunteer or nurse measures the weight and height of each child. Vin also tries to create more health awareness, so the children also get a talk about health and personal hygiene. Vin covers the medical costs and transportation costs of the health camps.
And they provide funding for the health camps every 2 weeks so that we're able to bring medications to the children. I very much enjoyed my time here in Nepal, and in particular with my homestay in the community. I really enjoyed the health camps that are conducted every 2 weeks because I feel that we're really making a difference and bringing health care to those that aren't able to access it.
VIN organizes women and child waste trainings. Creating awareness of the waste problem helps managing the waste. There are many trainings and home visits in the community to prepare the installation of the first public bin in the community and to make people use it. This is one of the women meeting in Chiragaon. The women understand that collecting the waste and put it into a bin is better for their health, and they are really enthusiastic for the bin placement. This local bin will soon be replaced by a VIN-sponsored public bin.
I talk about their benefit, what they are getting from this. They are so glad to have this type of training and to manage the garbage, because after managing this, they say that the people who were used to be sick before, before the managing of this garbage, now that number is very less, and they are so excited that they came to know that we should manage the garbage. They are interested to do this work, and really it is good for us, and that is the good and what we are doing. I think we will achieve our goal.
This community health project, people started thinking, okay, these are the things also bring people different diseases. And now I think many people are aware that waste has been the problem, and they want to remove from their surrounding. You talk to women or any family members in the community, they at least feel that they need to clean their surrounding. They need to go to the health post in time if they are sick. So awareness is the main part I think VIN has achieved so far, or given impact to the community.
VIN has tried to create some awareness in the community. Also, Kalpena and Pavbati de Gota, two women from Dadagaon, say that their lives has been changed by the health program. VIN helped them build a toilet, they will use the first public bin, and they can now go to the health post if they are sick.
अब टोयलेट बनाउन पनि दिनु भएको छ, तर टोयलेट बनाउन उहाँले देशमा नि हामीलाई त धेरै खुसी लाग्छ। खुसी लागेर पनि हामीले बनायौं, अनि फेरि अब उहाँले आदि सहयोग गर्नुभयो, हामीले आदि हालेर हामीले राम्रै बनाइसक्यौं अहिले।
हामी किन नगर्ने, एकदम खुसी साथ गर्छौं नि। अब अहिले सम्म त हामीले खोल्छ, घर वरिपरि फैलिरहन्थ्यो भने दराममा लगाएर थुपार्न त हामीलाई राम्रै भयो। हाम्रो गाउँ घर सफा पनि हुन्छ, हामीहरु स्वस्थ बन्न सक्छौं। फोहोरले गर्दाखेरि कति रोग लाग्ने दूषित भइरहेको छ, हामी लहरा हाल्छौं।
We have a plan, we have the objectives, and we want to meet it, but because of resource limitations like funding and human resources also, sometimes we are facing a problem. I hope we'll try our best to get that.
VIN is truly committed to help disadvantaged people health in Nepal's most marginalized communities. This, however, can only be achieved through the continuous generosity of health volunteers offering their time and experience, and from donations, either monetary or in resources. To reach the targets of the health program, VIN needs your support.